Genital cultures can show bacteria and fungal pathogens like group B strep, strep Agalactiae, E. coli, Listeria monocytogenes, Candida, and Neisseria gonorrhoeae. And DNA probe testing, organisms are not cultured in this method. The presence or absence of genetic material is confirmed. A swab is broken off the top of a sterile tube, and that's provided. The swab is then capped, or the tube is capped, and the swab and the tube is sent to the lab. So thinking about specimen connection for females or AFAB individuals, you want to avoid using lubricant on the speculum if possible. Visualize the cervix and use a swab to remove any mucus if necessary. Insert the sterile swab into the endocervical canal and rotate to allow absorption of organisms. And then these are often inoculated on a Thayer-Martin plate or for gonorrhea. And then you insert the swab in transport tube. You're not inoculating. You're essentially just collecting the swab and placing it back in the transport tube. Specimen collection for AMAB individuals or males is you would gently insert a small wire swab into urethra and rotate, or you can use a sterile swab to collect urethral discharge, and then you would place it back into the tube and send it off to the lab. But there is a specific plate for growth for gonorrhea that the lab uses. One thing of note is that you do not need to collect an endocervical canal sample. We'll see this for gonorrhea and chlamydia collection. You can use a vaginal swab for females or AFAB individuals. And for our AMAB individuals, you could use a urine sample. But if you are going with the best collection method, endocervical and urethral will be able to obtain more samples potentially than a vaginal or urinary swab.